everyone, this is Amar Zadi, and today I'm going to be doing a video on EKG, more specifically EKG leads. Let's get right into it. Alright, this is basic stuff. You guys have probably seen an EKG graph or script. It's basically like a graph paper which shows voltage versus time, and you can see various deflections going through it, which tend to indicate the state of the heart, what action it's doing, and all that stuff. Pretty basic. Now we'll do a quick recap on deflections. Now this is the P wave, which means atrial depolarization. This is when the atria contract, causing some amount of blood, like the remaining blood, to get pumped into the ventricles. This is the QRS complex. This is the ventricular depolarization. This is when the ventricles contract, and this causes blood to get pumped into the aorta, or a pulmonary artery, depending on which side of the heart you're talking about. And this is T wave, which is ventricular relaxation and ventricular repolarization. This is when the heart ventricles relax and allow themselves to be refilled passively by the blood coming into the atrium. Now, atrial contraction does not entirely contribute to the blood filling process. Blood filling into the ventricles is always passive. It's mostly passive dependent. Only the remaining blood requires to be, when there's very little blood in the atria, it requires to be pumped. That's what the atrial activation does. Anyway, next slide. Now, this is an EKG script. I know this looks a little daunting, but I'm going to break it down one by one. Now, people tend to get what the deflections mean, the P, QRS complex, T wave, but when it comes to reading an EKG strip, it's kind of confusing when you look at these. What does 1, 2, 3 mean? What is AVR, AVL, AVL? Why is this pointing upwards? Why is this pointing downwards? I'll break that down a bit. So the standard EKG has 12 leads. There are 6 limb leads. They're known as lead 1, 2, 3, and AVR, AVL, AVF. Now the A stands for augmented because it's a combination of leads 1 and 2 or 3, depending on which which lead you're looking at in the augmented realm. The limb leads are basic. The 1, 2, 3 ones are attached on your limbs, as usual. And V1 to V6 are known as precordial leads, and they're placed on the torso. Okay, and they view activity across the heart. So let me break this down. So in lead 2, you notice the QRS complex is pointing upward. Yep, it's pointing upward, while when you look at AVR, the QRS complex here, it's pointing downward. And notice, let's lead V3. This is the QRS complex. It's pointing both up and both down. Now, this is really weird, right? Why is it doing that? Now, the thing is, all of these, here, 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 they're all QRS complexes. They all show ventricle depolarization. But what the real question is, why are they pointing up and down? What does that mean? I'll break it down. Next slide. Yeah. So let's take this diagram of the heart. Now you can think of electrical depolarization waves. It's like this wave that goes from here, then it goes here, then it can go from here, then it goes here. It moves in that way, this way, but keep in mind, when you sum up all these directions, like a vector, it ends up looking something like this. Let me use an appropriate color. Yeah. It goes from here to here. This is what it looks like. Maybe a little more downwards like this, but you get the point. this is the summation vector. This is what the wave of this is the net vector in which the wave of depolarization moves. Now, let's talk about leads. You can think of leads like, let's say, eyeballs. There's one eyeball here. There's another eyeball here. Now, we can call this eyeball AVR. And let's call this eyeball, not A, lead 1. Now, I drew a summation vector like this. Now, an eyeball looks at stuff, right? So, this eyeball is looking at the heart from the right side, okay? And this is looking at the heart from the left side. Now, keep in mind, both of them see the same thing, but the direction it's moving in, it's kind of technically different. Now let's say the summation vector is moving away from this eyeball while it's moving relatively towards this eyeball. So if I were to express this in an EKG curve, EKG strip, it would look like this. Look, it will go up and go down, the QRS complex. This is negative deflection because it's moving away. And this is positive deflection because it's moving towards, relatively speaking. Now let me expand on this concept. Positive deflection, by the way. Yeah, expand on this. Now here's AVR. Now here's the actual diagram of the heart with the leads labeled. Now compared to, let's say, so this is AVR. It views electrical activity from the right side of the heart. So from the point of view of lead AVR, the electrical depolarization moves away from the lead, right? It's moving away. So this causes a negative deflection. And then you're talking about, let's say, lead AVL and lead 1. They see ventricular activity on the left side of the heart, and they will see the summation vector of forces move towards them like this, because positive deflection. So yeah, that's all it is. And then there's lead 2, 3, AVF. They view electrical activity from an inferior angle. And lead 1 to V1 to V6 view electrical activity across the heart. We view electrical activity across the heart. No, that's kind of it. It's all about perspective. Think of them as eyeballs. This guy sees it from a different view, this guy sees it from a different view, this guy sees it from a different view, but they're all looking at the same thing, ventricle depolarization, the summation vector moving, but moving away, moving towards, depends on their relative point of view. Now, let's go back to the EKG script. As you can see, this is lead 2, I think it's about AVR. You see the complex is pointing downwards because it was present at the right side of the heart. Therefore, it sees electrical activities move away from it. V6 sees left side of the heart. Hence, it notices the positive deflection as electrical activity moves toward it. And lead V3, which was precordial lead, which is placed across the heart, it sees electrical activity in the middle. That's why it sees some complexes going up, some complexes going down. And that pretty much covers leads. Let me end this slide with an ending note. Go through it, EKG is 12 leads. I just went through this. Anyway, if you guys have any questions, leave me some messages. I'll respond. Thank you.